What if the pill you take every morning, the one prescribed by your trusted doctor, the one you reach for without a second thought, was quietly rewriting the story of your health? Not in the way you expect, not with the healing or relief you hope for, but with silent changes that could someday put your life in danger. This isn't a far-fetched conspiracy theory. It's a hard medical truth buried beneath years of routine, regulation, and reassurance. And yet, few are talking about it. Every year, millions of people across the globe swallow this pill. It's familiar, often recommended as a solution for everyday problems. You find it on pharmacy shelves in every city, prescribed for conditions as common as anxiety, depression, high blood pressure, or even sleep trouble. The boxes are neatly stacked, the instructions are clear, and the sense of safety is palpable. But behind this facade of normalcy, there's a shadowy reality, one that has only recently begun to see the light of day. The medication in question isn't rare or experimental. It's not reserved for the critically ill or confined to hospital wards. It's used in homes, offices, schools, by people of all ages, from all walks of life. And it often goes by many names, disguised in combination formulas or prescribed for secondary symptoms you might not even associate with its original purpose. But now, mounting evidence is revealing a disturbing pattern. Recent studies have drawn a direct connection between long-term use of certain medications, particularly antidepressants, and a host of severe health risks. These aren't just minor side effects, the kind you might expect or read about on an information leaflet. They are life-altering, sometimes life-ending consequences that have, for too long, gone underreported or overlooked. Among the most alarming findings is the increased risk of sudden cardiac death. According to data from a comprehensive study involving more than 4 million people, individuals who used antidepressants for as little as 1 to 5 years faced a 56% higher risk of dying suddenly from heart complications. For those on these medications for 6 years or more, the risk more than doubled. This wasn't limited to older adults or those with pre-existing heart conditions. In fact, the risk was most pronounced among younger adults, particularly those aged 30 to 39, where the likelihood of sudden cardiac death was 3 to 5 times higher compared to peers who hadn't taken the medication. But the dangers don't end there. Prolonged use has also been linked to a higher chance of stroke and other cardiovascular diseases. Some patients experience subtle cognitive decline, memory loss, or persistent brain fog, symptoms that are easy to attribute to aging, stress, or the underlying condition the medication was meant to treat. Others develop liver or kidney damage, silently accumulating harm over years of faithful adherence to their prescription. Perhaps most unsettling of all are the withdrawal symptoms. For many, stopping the medication, even under medical supervision, can trigger severe reactions. Dizziness, insomnia, agitation, and in some cases, dangerous spikes in blood pressure or heart rate. The body, having grown dependent on the drug's chemical influence, protests its absence in ways that can be both frightening and harmful. These revelations have forced a reckoning in the medical community. Dr. Alan Michaels, a pharmacology researcher at a leading US university, puts it bluntly, "We've known for a while that certain widely used drugs carry risks. What's emerging now is the scale of those risks and how underreported they've been." For years, the conversation around these medications has focused on their benefits, the relief they provide, the lives they improve. But as Dr. Serena Hale, a respected toxicologist, points out, patients trust that what's prescribed to them is completely safe, and most medications are. But when it comes to this specific compound, the benefit-risk balance is shifting, especially with prolonged use. Why has it taken so long for these risks to come to light? Part of the answer lies in how side effects are reported and studied. In the rush to bring new treatments to market, rare or long-term effects can be missed. Sometimes symptoms are so subtle or so easily attributed to other causes that they're not linked back to the medication at all. In other cases, pharmaceutical companies, eager to highlight benefits, may only gradually acknowledge the full spectrum of potential harms. Consider the story of one patient, a middle-aged professional, active and health-conscious, who began taking the medication for mild anxiety. For years, they followed the prescription exactly, attending regular checkups, never missing a dose. But then, without warning, they experienced a severe cardiac episode. Only after a thorough investigation did doctors connect the dots. The medication, combined with subtle genetic risk factors, had triggered a cascade of events that nearly proved fatal. This isn't an isolated incident. Similar cases have surfaced around the world, many only recognized after tragedy strikes. But here's the real shocker. The pill in question might already be in your home. It could be in your bathroom cabinet, your travel bag, or even in your child's backpack. It might be under a different name, prescribed for a seemingly unrelated condition, or bundled into a combination therapy you never thought to question. The labels can be confusing, the warnings buried in fine print, the true risks obscured by medical jargon and marketing gloss. So what can you do to protect yourself and your loved ones? The first step is knowledge. Identify the medications you or your family members are taking. Don't be afraid to ask your doctor or pharmacist direct questions. What are the known risks? How long is it safe to use this medication? Are there alternative treatments with fewer long-term side effects? Look for hidden terms on the label, such as extended use, combination formula, or unfamiliar trade names. These could indicate a higher risk profile, especially if the medication is being used for an off-label purpose. Above all, remember that this isn't about panic, it's about power. The power to question, to investigate, to advocate for your own health and well-being. The real danger isn't the pill itself. It's not knowing what it can do or assuming that every prescription is risk-free. Medicine is a tool, and like any tool, its safety depends on how, why, and for how long it's used. In the coming months, more research will emerge, more voices will join the conversation, and more patients will demand transparency and accountability from the medical and pharmaceutical industries. You don't have to wait for tragedy to strike before you take control. Start the conversation now. Ask the tough questions. Read the fine print. And above all, remember that your health is too precious to leave to chance. Join us next time as we go deeper, naming the pill, analyzing the latest research, and giving you practical tools to protect yourself and those you care about. Because when it comes to your health, knowledge isn't just power, it's survival.